Hi, I'm Kim, and I'm one of the PPI, that's Patient and Public Involvement, group on the STIMULATE-ICP study. The PPI group asks questions of and provides patient-led input to the incredibly diverse group of experts who are working on the study. And you may not be aware that the study has 3 strands of work or work packages. Often when we talk about the STIMULATE-ICP study, discussion tends to focus on the second strand of work, work package 2, that's going to be putting patients through interventions including MRI scans and offering drug trials, and some of the PPI group will be making a video about that. But there are 2 other strands of work within the STIMULATE-ICP trial. The first strand looks at existing long COVID clinics and patients, and the final strand looks at inequalities in access to long COVID care. Today, I wanted to ask 2 of the lead investigators on that first strand of work, looking at long COVID clinics and patients, to explain a bit more about that part of the trial, why they're taking that approach, and what they'll be investigating. As someone who's had long COVID since March 2020, I feel that it's really important that there's investigation into what's been happening for people with long COVID to date. I'm pleased to say that I'm joined by Professor Amitava Banerjee, who's Professor of Clinical Data Science at University College London and also an honorary consultant cardiologist at University College London Hospital. Ami is leading the STIMULATE-ICP study and has been involved in long COVID research since 2020. We're also joined by Dr. Mel Ramasawmy on the call today. Mel is a qualitative researcher at the UCL Institute of Health Informatics, working on inequalities in digital health. And because a qualitative research approach allows her to focus on experiences and look at trends and patterns, rather than just relying on quantitative data, it's great to know that she'll be working on this strand of the study. So, Melanie, we know that there are a number of long COVID clinics in England, but we also know that there seem to be quite a variety of experiences and setups, according to what we see on social media and the press coverage anyway. Is that something you'd agree with? And what are you hoping to understand about long COVID clinics with this research?
Thank you, Kim. I do agree with that. And I think it's important to remember that long COVID clinics or post-COVID assessment services were set up when the acute pandemic was really, we were caught in the headlights, and hospitals, intensive care units was where the focus was. And so we had to struggle to find resource, be it people, funding, infrastructure to set up these services. So in different places around the country, different things have been done depending on what was possible. And there are 90 clinics around the country, and inevitably there are variations in the care people have received and the way it's been delivered. What we now need to know is what impact that has had on people's recovery, their experience, and their care. And that's why studies like this are needed.
And you've mentioned there sort of what happened to people within the long COVID clinics. Do they recover? Are they still within the clinic? But I also wondered whether you're going to be talking to patients and doctors, and perhaps what you're going to be looking at when you do that.
Absolutely. We must talk to patients or people with lived experience so that we capture what they have felt from the first wave onwards of the pandemic. But also, given the strain on health services, given that this is a new disease, new care pathways, and in many ways, the NHS in the UK did something brave and unusual and set up a dedicated service for this to assess and to try and do more research. And so to understand how health professionals have taken on those challenges, what's worked, what's not, I think is terribly important to plan future long COVID services.
And just on that note, we obviously know that people are having these different experiences, and that there are perhaps some very different experiences within people with long COVID, that some people were hospitalized, some people weren't. What do we know already about these perhaps different groups of people with long COVID, and how might that feed into the research?
Thanks, Kim. There's data from routine clinics, particularly from the University College London Hospital Clinic, that already shows that even in people who had less severe acute COVID, they weren't hospitalized, that their functional impairment in terms of what they can do 6 months or a year on is reduced and as bad as people who are hospitalized. So not able to return to work, not able to fulfill their caring responsibilities, not able to do all of their normal activities of daily living. And so we know that this is real. We know that it causes people a huge amount of morbidity. What we don't know is the subtypes or the different groups by symptoms and investigations. And we aren't able yet to give people a clear picture of what their trajectory or their recovery rate would be. So that's a big question mark, which we would be trying to fill also in this project.
Great, thanks, Amy. And Mel, we've talked with Amy about sort of what the different sort of elements that the study's going to look at are, like the trajectory of patient experience, what's happening for both patients and health professionals, and the patterns that we're seeing in different groups of people with long COVID. But why is it important for us to look into this?
Thanks, Kim. By talking to the patients and the staff at the different sites that are involved in the STIMULATE project, we can understand what things have worked well and also what things people would like to see improved. This helps us make recommendations about what can be done to improve patient experience of care in the future, but also about what can be done to support services. So it could contribute, for example, to national planning for staff and for funding for the long COVID services.
And just taking that a little bit further, and you've talked about funding and care in future. Are there any other outcomes that you're hoping to achieve with this research?
Well, I think it's really important not only for long COVID, but future pandemics, that we recognise that we have focused on the acute stage or acute phase and the infection, and less on the post-infection complications and how they need to be dealt with, investigated and treated in health services. And the scale of long COVID has shown that we've been caught unawares and that we didn't plan for that, we weren't prepared for that. So in future, I would hope that our type of research shows that you can do this kind of quantitative, looking at the numbers and figures from different clinics, but also the interviews and the questionnaires and the surveys, the work that Mel is leading on the qualitative side, to find out about people's experience in those services. And that kind of work's really crucial to inform the now, but also the future, so that we don't get caught unawares again.
Thanks, Amy. And just picking up on a point you made there in terms of talking about the qualitative research that Mel's going to lead on. Mel, I wonder if you could explain what a patient might experience if they take part in this arm of the study. What are they going to be asked to do to give their input to you?
Absolutely. There are a few ways that patients can get involved in this part of the study. We will ask patients who have accessed the long COVID services across their lifespan to take part in an interview or a focus group, where we'll ask them about their experiences of the care, what they felt worked well for them, and what they would like to see improved in the future. We might also ask patients if they're happy for us to access information they've already provided to the clinic about their symptoms and their experiences of long COVID, and ask them to repeat the questionnaires or forms that they might have filled in already. And that helps us understand how things have changed for them over time.
Thanks, Mel. So that's painted a really nice picture of what someone might be asked to do if they sign up to take part in the study. And Amy, I just wanted to ask you if you perhaps had a message for those people who might end up participating in the study, because we know that people who've had long COVID since the very early days of the pandemic are possibly, fair to say, a little bit frustrated at this point. They really want to see some answers coming out. And I wonder if you could just say to those patients, why it's important for them to take part in this particular arm of the study.
Thank you, Kim. There's no doubt that we need interventions to be tried and tested, and we need them to be tested fast. But it's not either or. In a new disease like long COVID, where we're struggling to fully define it, where we haven't got the full information about the subtypes and the trajectories, that information is needed to inform what treatments might work and who they might work in. And also it helps us deliver care as best we can with limited resources. So we need to do the kind of research that we're proposing in this work package to find that baseline and to inform our care. And that's no less important and will help us to develop treatments and to develop interventions.
Thanks, Amy. And I think that's a really nice note to end on, with that message that if you do take part in this research and you do manage to get into the study, then by taking part, you will be making things better for future long COVID patients, people who come down the line, but also people who, you know, hopefully won't be affected by, but, you know, if we have any future pandemics, that, you know, we'll be able to build services on the back of research and data and evidence like this. So you will be making life better for people in future. I think that's really important. Thanks, everyone.
Thanks, Kim.
Thank you.